Good evening, ladies and gentlemen. Welcome to a new episode of The Giving Hand. Today, we're going to have a special guest. She is a doctor. She is a pediatric consultant at Department for Childhood of Blood and Cancer Disease. And also, she is a member of I Want to Learn Society. She's going to talk to us about her challenges, her tasks, her achievements, and much more. So please, dear viewers, stay tuned.
We may not know the value of things until they are taken away from us. Education, health, and socialization. These are things we always took for granted. Pay attention to the feelings we felt when COVID 19 took over the world and when it deprived us from these essentials. Can you imagine going through that again? Can you imagine being isolated and fighting illnesses?
Welcome again, dear viewers, with our guest, Dr. Maha Borisli. She is a pediatric consultant at the Department of Blood and Cancer Disease for Children, and also she is a member of I Want to Learn Society. So, hello and good evening, Dr. Maha.
Good evening, and thank you for having me.
You are most welcome. I'm actually so delighted to have you with us this evening, actually.
Likewise.
So, first of all, Dr. Maha, we'd like from you to introduce yourself to our dear viewers.
I'm a pediatrician and I work with the children who have diseases like blood disease and cancer, specifically leukemia. And I'm a member of, as you said, I Want to Learn Society, the society interested in teaching children inside hospitals who are not able to go to the school.
That's really interesting, like teaching children inside hospital. So how actually you come up with this idea?
Every pediatrician, when dealing with children, we have to deal with every aspect of the child's life.
Yes.
And when I started working at the pediatric department, I noticed children who stay in the hospital for a very long time. They stay also away from school for a very long time.
Yes.
No matter what toys you bring or you play with them or you bring their friends to them, you notice an element of depression in these children.
Yes.
So taking away schooling and school and learning is very difficult for any child.
Exactly.
That's why I had that idea.
It is really a great idea, Dr. Maha. We're gonna clarify more about your society. But when actually did you start this society, Doctor?
We started roughly around 2015.
Yes.
Before that time, we tried many times to liaise with many societies to have some sort of program inside my department. Unfortunately, most of these societies they have specific needs to address.
Yes.
And then while we were sitting first in a conference, then in a family gathering, I had that an idea.
Yes.
So in a conference, one of my colleagues, Dr. Iman Tawa, she said, "What's your new?" I said, "I want to make a school at a hospital." She said, "Let's just go for it."
Yes.
And immediately we went to one of the well-known societies, the Patient Helping Fund, with an idea to help us in establishing a league or a society or group in order to cater for these children, teaching children in hospitals. All the other societies, it's not their scope. So that was something new. And then in a family gathering, we found the first volunteers.
Yes.
And then we sat together and started the idea.
So
and we made the first move.
The first move started from your family gathering.
Yes.
That's amazing. So the title is I Want to Learn, أبي أتعلم in Arabic.
Yes.
Why you named it this unique title, Doctor?
It was very difficult in the beginning. We were like brainstorming.
Yes.
What is going to be the name? For example, is it a difficult mission? Is it, overcoming your obstacles? And then I said, well, it's the child asking us for a service. So this is the child cry. This is his need. He's telling you, I want to learn in the hospital.
Yes.
So why would we just name it as it is? So we went with this name as a professional, and then we found that it's a very catchy name, and when we continued with it.
This is a very catchy name, Doctor. So basically you are grabbing any ill or like say sick child, even from till the teenage age, isn't it?
Yeah, until 18. We started from 4 to 8 years. And then gradually we extended the age until year 12, which is around 18 years.
Around 18 years. So basically you're gonna like organize a class in the hospital, isn't it?
Yes, exactly.
So how many hospitals here in Kuwait?
We started at the beginning, we started with children with cancer and blood diseases, because these children, they are the children who stay longer in the hospital and even outside the hospital, but they're away from the school. And again, it's my, with my work. So we were very fortunate with the former Minister of Health and Minister of Education. They helped us in establishing our first class. And these children are registered absent from their school. Immediately we found a sponsor and volunteers, and we started the first class inside the hospital. We try to make it like a safe haven. Whenever you enter this class, you feel you are outside of the hospital.
Yes.
And the children will feel comfortable to learn. In the beginning, we cater for children inside the hospital who are receiving their treatment. But then we extend the service for children outside the hospital who attend outpatient department.
Yes.
The next step, we established our second class. It is in the Razi Hospital for children who have fractures, for example, who had to stay 2-3 months on bed. So also we extend the service for them. And then the third step we took is that we established a small a place for us, for children outside the hospital. So we have a small school that it's in one of the residential areas, Jabriya.
Yes.
For children who are receiving their treatment no matter what, and they are away from school, and also they're not in the hospital.
Oh, okay.
And we have, an aim that we will have a class in every hospital. So we have 2 hospitals. They already asked for us to start their class. And hopefully we'll do that.
Hopefully, doctor. So why actually you felt that these children, the sick children, actually, they need education? Do you feel like they're facing obstacles and they are struggling while they are having that disease, like a cancer or any kind of disease, while staying away from education? So why actually you felt they need it?
When I started, when I was in my beginning, it was in a general pediatrics. And at that time, I saw a lot of old school dedicated teachers.
Yes.
So whenever the child stays in the hospital more than 1 week, they will come, from their selves. They come and teach these children in the hospital.
Yes.
Once the child gets discharged from the hospital, he's ready to go back to his life.
Yes.
Nothing missed. But when I started working with children with leukemia, it's a very long stay. And they become deprived, step by step from their normal life. First, they're deprived from their family.
Yes.
Then they are deprived from their friends, and then they are deprived from their schools. And then we, as doctors, we used to tell them, concentrate on your treatment, forget about school.
Yes.
With time, I noticed some of the children become really depressed. This really, halt our treatment. We don't get really nice response with treatment. Some of them, they're
having like a harsh time.
Yes, and some of them, if we take scientifically, even their blood indices is not correcting because they don't feel, for me, this is what I feel, that because of this depression and feeling, they are held away from their normal environment, they don't respond really well.
Exactly.
The element of depression is still there. And some of my children even refuse to take medication because most of them, they said, our life is just ended. It's a very difficult disease, difficult treatment, especially those who are teenage. It was very difficult.
Yes.
And then I remember now what happens with these children prior to 2015, and I compare them to children after that. It's completely different.
Yes.
The happy moment for me, when we started in the beginning inside the hospital, whenever I finish my work, about to go home, and I've already seen my patients in their hospital beds, we wrote for them treatment, we started their treatment, and we finished, we're gathering ourselves just to go home.
Yes.
I noticed same children, they put the backpack and go to the class.
Oh, okay.
It is a happy moment for me.
Yeah.
At least they try to maintain minimum normality in their life.
Exactly. They want to get involved with the education, with their
Exactly.
friends, with their normal life, back to
Yes.
their normal life, and get busy and get away from being and thinking about being ill.
Exactly. These children, they understand everything. Even if you don't talk to them, they know it's a difficult disease.
Yes.
They know it's the outcome. We don't know, everybody has his own outcome. They know that the medication is going to be difficult, but now they know everything is going to be all right. They have their own future. They have to succeed. They have to concentrate on their study, because this is just a journey, the journey of treatment. It will end in a very positive way. But meanwhile, they have to focus on their future so that when they go back to school, they're ready.
Yes, what a great idea, Dr. Maha. So let's talk about the teachers. So those students need teachers.
Exactly.
So how actually do you gather those teachers for those students?
In the beginning, before we start this project, you don't want to start from scratch.
Yes.
You will. We have to learn from other people's experience. So we started with a small conference, and then we invited people who had this experience in their countries. For example, we have visitors from USA, from Oregon, and they have departments inside the Ministry of Health for teaching. Then we have from Jordan, from Egypt, and from Saudi Arabia. And then we learn what they're going to be their obstacles, what they learn, and then they taught us how to start, from where we start. The first thing we did is that we had some volunteers, teachers who wanted to come with us and be part of this project. And also we had a help from the society, Najat Society. They helped us with many of their teachers as a volunteer. We had help also from some of the private schools,
yes,
as well as I think Algeria Enterprise. All of them, they have teachers who will come and help us free of charge.
Free of charge. So they are volunteers. All
Volunteer
of them.
totally.
Okay.
So the first thing we did is that we give them a workshop on how to deal with a child, with an ill child, what to expect.
Yes.
From the point of view of doctors, from point of view of psychologists, from point of view of teachers who are specialized in special learning.
Yes.
And they have to learn our guideline and what to do and what to do or not to do, what to say, what not to say, and how to communicate with the doctors if they see anything. So these children, these teachers are well educated with these children.
Yes.
And then we started with this years. With every year, we have this workshop, just a reminder for the newcomers, volunteers.
Well, that's really great, Dr. Maha. We'll move on. But after this report, dear viewers, let's watch it together.
Some children need long-term treatment against cancer and chronic diseases, making them unable to attend school and missing the chance of getting proper education. Thankfully, however, I Want to Learn Society takes on an enormous task to take care of children who can't make it to school.
And we are back again, dear viewers, with our guest, Dr. Maha Bursley. So, Dr. Maha, we're talking about the teachers and how they are teaching. They are totally volunteers. And now let's move on with the members as well. So, how many members are they in the society, actually?
In the beginning, we were a very small group, around probably 12.
Yes.
Consisting basically of doctors who are seeing these children,
yes,
as well as educators who are very interested in the subject, as well as parents who have been through this experience.
Yes.
Together, we formed the first at the beginning as a league, and then we started with the 15 members, and then we are now growing as members of this society. Irrespective of the number of the doctors, the teachers with us.
Yes.
And at the beginning, there were many parents who happened to be teachers or, director of schools. So they have a very good idea how to run a school.
Yes.
And they were with us and on board when we started our society.
Exactly. So, doctor, if a teacher wants to join your society, what is the procedures to join it?
We have in our social media, I think it's going to be in the screen.
Yes.
You can contact us, and we will, of course, we will assign them. They have to, we need a commitment because you have to finish a semester with us, not just a few lessons and that's it. Then we will provide a special workshop to teach them.
Yes.
And then they can, of course, they have their own classes, and they can choose which age they want to work with and the subject.
That's easy, actually. So let's talk now about you, Dr. Maha. What is the most important tasks for you and roles for you while you are doing or volunteering in this society, Doctor?
Basically, my role is, having, let's say, some sort of timeline, or trying to figure out our scope in the future.
Yes.
Where we want to open the school, how we are going to open the school, how can we extend, how we can preserve this, service.
Yes.
How to get the fund, for example. I'm trying to, find sponsor, how to sponsor this. So my work behind class, not exactly, not inside the class.
Yes.
Yeah.
So what about you before starting this society, Dr. Maha? When actually you felt that I'm going to be a volunteer?
I was waiting for that time to be volunteer because, after graduation, I had to work few years and then get my board and finish my examination. The minute I finished my, I took my degrees and started to work with the children with childhood leukemia and hematological disease.
Yes.
I found that it's not enough being a doctor.
Mm-hmm.
The minute you finish your work, and maybe I spend 1 hour explaining. The minute they leave my office, not all of the patient will take my advice, and just do it. They need support outside the hospital.
Yes.
And although we have it's very unique. We have a lot of societies, but there are many societies, they don't look specifically to my, specialty, for example. And I found out that there are many services. There are many services already being, offered in my department. For example, Patient Help Fund and also Catch. Both of them, they cater for child life.
Yes.
But they don't concentrate on education.
Yes.
And which is more important. If you can make the child play all day long, but at the beginning he'll go to his room and feel depressed because all his children, all his friends in the school. So I had this idea, but it wasn't until 2015. Before that, I was very passionate about other areas. For example, I work with Thalassemia League. So, they were part of the Kuwait Medical Society, and we worked with the premarital screening, and we are very happy that it was. We had a workshop and we had our own project. We extended to the Ministry of Health, and then the Ministry of Health together with the government, they work together, and then we had now the clinic for premarital. And it's part of anybody getting married, they have to go to premarital screening, and we are one of the best countries in the Gulf that people will respond for this screening, and we have a drop of the hematological diseases, specifically those related to hemoglobin, thalassemia and sickle. So we're very happy that we don't have as much as we used to have new patients.
Yes.
I worked with Pediatric League, and we tried to address many childhood issues. We through newsletters and through conferences, educating doctors and also educating parents of the family. We have a lot of publishing materials for them. We had also made the first relief missions. We went, in the beginning of Syrian conflict. We went in 2 drives that it's a medical drive, and me and my colleagues in the league, we went twice and started establishing that. Later, many society completed the work. We were just at the beginning assessing the situation and seeing area that because everybody was, thinking of food and shelter. We were thinking of medical attention that nobody's taking care of.
From your point of view as a doctor.
Specifically children vaccination and education. And this is what our passion. So we went there just to assess, and then talked about this, and then other society came and, mashallah, they helped for more than 8 years. They've done their job or more. I also participated with Hope Group, which is a group that specifically for pediatric surgery, extending treatment for those children who they don't have, a very specialized pediatric
Yes.
surgery.
Yes.
I was very fortunate to be, they asked me twice to go with them. So I went with them to Benin in Africa, and then I went with them in Kyrgyzstan.
Yes.
I was very fortunate to be with that team and witnessing what we can offer. And sometimes it's very small, but it make really big change in their life.
Yes.
And also we help assessing the lives in these countries and where we can extend help. And fortunately, many society
Yes.
later came and continue our work.
Well, we are so fortunate actually to have such a great lady, Dr. Maha. And I love when you said that being a doctor is not enough. Like being a doctor, especially specialized in children, the cancer disease children, is really a noble job to do. So imagine that you are saying is not enough. Is I like to be volunteer and being volunteer to too many actually society, which is really great, doctor. So, doctor, let's talk about how actually volunteering work shaped your life.
When while working, I had many doctors, coming to my work as part of their specialization,
Yes.
pediatric board. And I always tell them working in my department is so different than working in general pediatrics.
Yes.
I always tell them our dinar is different than the dinar you get from other hospitals, stays longer.
Yes.
So it's kind of when you work in my field, you feel the blessing in your life. You feel it in your health, in your children, in your house, in your work. You feel the importance of time.
Oh.
It's so difficult for me to go anywhere unless I feel that it's going to be rewarding for somebody else. You don't want to waste time. Times become really precious when you work in a ward of leukemia.
Yes.
So this is what I learned, that we have to use our time. We
Yeah.
can't just, try to shoot time going here.
Exactly.
It's important also to have a relief from time to time. Yes, to go and change, travel, sit with friends. This is important. I'm not saying it's not important, but it shouldn't be your life.
Exactly. So it is really the importance of time. So, doctor, how actually did you manage your time between being a doctor, a consultant, and being a volunteer in your society?
It's not difficult. Having the class inside the hospital, it's very easy, because I know exactly what's going on regarding their treatment, and we took agreement from the parents to convey some of the messages to their teachers and vice versa.
Yes.
It's not difficult if you just organize your time. It's not difficult to trying to haggle all these together.
Yes.
So I know if, for example, when I work with the thalassemia, when we do we used to do campaigns for adhering to treatment.
Yes.
When we do these events, that how to take the medication and how to adhere to your medication, when I go back to my work, it makes my work easy.
Oh.
Because I will not work a lot trying to tell each and everyone what's the importance of taking your medication, your time, and what's the consequences going to be. People will adhere to their treatment. Even my work will be lesser because they are more they know exactly what's going on with their treatment.
Yes.
So actually having these activities really helpful in my morning work.
Yes.
So when you have a happy child going to school, but going to his studies all the time, I know that he will not come with the complications a lot in my work. I will not see him a lot.
Yes.
He's a happy child. So I don't know, some sort of this happiness will reflect on their health. So I'm not going to see them a lot in my, coming to me with complication.
Yes.
So I don't see it's difficult. It's just part of my daily work.
It's a part of your daily work. We are really enjoying our interview with Dr. Maha. We're going to learn more about that. But dear viewers, let's have this tiny break and then we'll move on.
I Want to Learn is a licensed Kuwaiti NGO made up by a group of consultant doctors, educational professors, and volunteers. Their mission is to seek continuity of education for sick children with chronic diseases who are receiving treatment in hospitals. They offer their students a plethora of activities and workshops to keep them engaged and motivated. This society is dedicated to make these children dreamers and achievers.
And we are back again, dear viewers, with our guest, Dr. Maha Bursli. So, Dr. Maha, Well, I'm pretty sure you faced a lot of challenges and obstacles while you are doing your voluntary work or before starting your voluntary work, especially here in the society. Can you please elaborate more about that?
For example, when we started, starting the society, in the beginning, most of the societies, and even until now, they helped us and they support us in every way, shape they can. For
Yes.
example, I want to Patient Helping Fund, Najat. They help us a lot, and Najat Society and these two. They gave us a place with the funds and everything. But then when we started this, society, it was unique. We fall between three ministries: the Ministry of Social Affairs, the Ministry of Education, and the Ministry of Health. So there were very, it was very intricate. Going knocking the door on every ministry. It was a little bit challenging.
Yes.
We still haven't finished our, we finished our structure, but we didn't reach our goal, which, avoiding any student to have exams in their schools. They have to have when you have a child who is very sick, then they have to go against our advice and go to the school just to have exam.
Yes.
We are looking forward to having the exams inside the hospital or inside our, main.
It's gonna be much better actually for them.
Yes, and I've seen many children who are very sick. They went to their schools, and it was very difficult for them.
Yes.
The second obstacle, of course, sponsoring. Because when we started, many society, when they start, they have their own sponsors. They know that we have big shot sponsors that whatever they will do, they will not have a difficulty having the place and the money. We started without looking. Everybody said, how can we start without any sponsor? But subhanAllah, once we start any project, the money comes with it. So project-wise, we are having no problem, but continuity is still in our, back mind. So we hope that we will have enough sponsorship that will continue for the, years to come.
That's really great, Dr. Maha. So you have a really long history in voluntary work through years, and you love what you are doing actually, and being proud of yourself, I'm pretty sure. And so far, like from now, what do you want to achieve in the future, Dr. Maha?
Many things. I still have a lot of projects regarding childhood.
Yes.
Today I was having really very fruitful discussion with the doctors who are part of the KIMS program for pediatrics about what we can do for children. I have a lot to do for children that we know that the standards are very high in Kuwait, but that doesn't mean that we want it to be better.
Yes.
So there are many projects I'd like to work for childhood or diseases or children in future.
Yes.
For my society, I want to learn society. I want to have the education accessible to everybody. Now, one of the things we are dealing with that I forgot to mention, once we started, we wanted to start at the point where everybody else has finished, so that will continue. So we noticed, for example, children who were in Syria during the conflict.
Yes.
Some of them, their education, didn't stop, and they don't have school. How did they achieve it? Because through the online learning.
Yes.
From that time. So just before the pandemic, we tried to, make the education accessible through online, and we started to have our own platform, and we worked with the Kisar Kuwait Institute for Scientific Research.
Yes.
And then came Corona. So when the pandemic hit Kuwait, we were our children, the only people who finished the whole system of the school.
Wow.
They continued to learn because we were already online.
Yes.
So we want now again to reestablish online learning specifically for children who are receiving their treatment outside Kuwait. So their treatment and their education will not stop. So again, my hope is that to have this schools and classrooms in every hospital. So the education will be very accessible to everybody.
Well, I hope so, Dr. Maha. In the future, you're going to have access to all hospitals around Kuwait, and also all around the world, actually, not even in Kuwait, inshallah. So, Doctor, I'm pretty sure you faced many situations, bad, sad, and the happy situations. We would like from you to share with us a story, one memorable story that you will never forget.
Actually, I have 3.
Okay.
When I started working with children with leukemia, I have a very memorable patient, and she was beyond her age. She was 8 years old, and she gave me the first lesson that being a doctor, we shouldn't have boundaries. So any doctors, when you go to any doctor, there is a boundary, how to address your doctor, how to respond, in our work, we don't have boundaries. We know the patients very well. We know their family, we know their even neighbors, we know their children, other children, we know their life, we know their staff, we know everything about their life. And when they come to our office, you see that it's very, intimate setting. It's not a hospital. The children, coming to me, it's like having, a grandmother or mother or auntie.
And this
it's
is the
not
purpose,
a
actually.
doctor-patient relationship. We
Yes.
just, try to, remove the boundaries. It's not the time for them to have boundaries. So this patient, this child, she taught me this all the time. Going to our offices and distributing to us necklaces and small gifts that she made, and then she comes and discuss about everything. Unfortunately, immediately after I worked, she passed away, and it was very trauma, even because the first child for me.
May God bless her soul.
And then the second, inshallah, and the second child, we had a child that, whatever I do for him, he was very angry.
Okay.
He was, and then I just stopped. I said, why are you angry? He said, I'm not happy with your place. Everything is in white. Everybody is in white. It's like, having bad dreams. I'm having nightmares with this white color everywhere.
Okay.
Why there is no schools? Why nobody's, playing with me? It's a very horrible place. After this child left, and fortunately he finished treatment and he was recovered completely. And I saw him 2 years ago. He completed his study, but I expected him to be, continue his higher education.
Yes.
And I said, I wonder if this child came at the time when we had the school, I'm sure he would have achieved a lot. But he taught us how to change the environment to be, childhood friendly. So now in my work, you can't see white. Even the workers, we don't wear lab coats. Long time ago, we wear our normal clothes. The nurses also, they try to break the white color.
Yes.
Everywhere is painted. Even the treatment room, when you enter, it's really a lot of colors. You will not see the white.
Yes.
No, there is no white.
It's really great that you get inspired from
one child that changed the whole practice.
Wow.
Even when any child received the treatment, sometimes we have child life specialists that would play with them while they're receiving treatment. So it's very child-friendly atmosphere.
Yes.
The second child, they changed. The third thing, it's a happy moment. I have a lot of history, but these are the points that shaped whatever I'm working with. The happy moment is that because last year, because of lockdown, we managed to have some sort of gathering because we have the first graduation. 5 children graduated from our school. They finished their study. 2 went to study abroad. 3 stayed in Kuwait.
Wow.
And wearing their gowns, graduation gown, it made, my year to see them finish their treatment and, moving in their life.
Wow,
so that's a proud moment.
That's really a great story, Dr. Maha, and we are actually so proud of you. And I'm so delighted that I host you today in our show. And best of luck for you and for your society, Dr. Maha.
Thank you for inviting me to, just shed a light on the work that we're working. It's not my work. It's a work of my friends in the society that have been there. And if I have time, I want to mention their name. First, Dr. Iman Tawa, when I sat with her, and she's the one who helped me. Dr. Muna Burisli, Dr. Muna Burhama, Dr. Anibal, Mr. Abdullah Al-Abedli, Dr. Anibal Burisli, Mr. Abdullah Al-Abedli, Dr. Salman, and many more that have been part of this wonderful journey.
Yes.
I would like to thank them for for knowing them and for going through this journey together. And I hope
Yes.
that we will continue in future.
Inshallah, in the future. And on behalf of our show, Giving Hands, we'd like to greet all your members. Thank you so much, Dr.
Thank you
Meher.
so much.
So, dear viewers, we reached the end of our episode for today. I hope you enjoyed it as much as I did. See you for the next one and have a nice evening.